Welcome, everyone. Thank you so much for joining us today. So today is another one of Wellspring's Be Well Talks. And so today is the fourth installment of a 4-week series that we've partnered with OMPRN for. And so if you have been tuning along for the other 3 series, this is a really great webinar series, and it's really designed to increase awareness and understanding of complex molecular topics. And so today's webinar is on being involved in your cancer diagnosis and treatment. So I'm going to pass the screen over to Leanne to introduce our speakers for today.
Everyone, it's a great honor for me to introduce today's 2 speakers for our final installment of this webinar series. OMPRN creates educational materials for members of the patient community on the topic of molecular pathology, and this is done by our patient partners. Both of the speakers today are both part of the OMPRN patient partnership team, and has had a hand in personally creating all of our resources that are currently available. Our first speaker, Karen Haas, is the Knowledge Mobilization Co-Lead at Access and is involved in many cancer biology projects as a person with lived experience. Our second speaker, Terry Harsh, is the Chair for Patient and Family Advisory Council at the Ontario Institute of Cancer Research. Together, Karen and Terry both have over 20 years of lived cancer and patient advisory experience. So on behalf of OMPRN, I'd like to extend a warm welcome to both Terry and Karen.
Thank you so much, Leanne. So I will, and thank you, Wellspring, for partnering with OMPRN on this initiative.
Oh, wonderful. Okay, so we'll get the ball rolling here, and so I want to thank you for the opportunity to speak to you today about ways to get more involved in your cancer care. Before we get into it, maybe what I'll do is just tell you a little bit more about me and my cancer journey, and a little bit about my motivation to get involved in patient advocacy, specifically patient engagement in cancer research. So my name is Terry Harish, and I am a cancer survivor and husband and father and semi-retired professional engineer. And back in 2010, I was diagnosed with a rare incurable subtype of non-Hodgkin's lymphoma at stage 4, with 90% bone marrow involvement, and given 2 months to live if I didn't immediately start aggressive treatment. So obviously I chose the aggressive treatment path, and looking at weighing risk versus benefit, a lot more benefit despite the risk. And so my particular therapy involved six rounds of chemo, 6 sessions of fractionated total body irradiation. I went through consolidation therapy after that with another chemo regimen, and then conditioning therapy leading into a stem cell transplant. And then beyond that, monthly maintenance therapy with a monoclonal antibody. However, countless scans and blood draws, and my real favorite, the bone marrow biopsies. I had quite a number of those, and man, I remember. You don't even want to think about bone marrow biopsies anymore. But happily, I came out the other side with a stable long-term remission that continues to today. And but as you would expect, there were many side effects that I continue to have to manage. I'd have to say overall my experience with cancer has really been transformative, and it causes you to see the world in a different way, develop new perspectives and priorities. And as they say, and this is so true, much wisdom and insights are gained from through the caves of suffering. So I think that encapsulates things best. but motivated by my cancer experience and really kind of being a little bit alarmed at the lack of treatment options, efficacy improvements, and severe side effects associated with standard of care type therapies. It kind of triggered a growing desire to want to help others afflicted by cancer. And one way I found to do this was by sharing and applying my lived experience as a patient partner and advisor in cancer research, with a goal of really trying to help shape research so outcomes that are meaningful to patients and experiences are achieved. And so for the past 7 years or so, I've been very, very fortunate to do this by collaborating as a patient partner on a variety of interesting clinical research projects at a variety of research institutions, cancer support organizations, government authorities, and regional hospitals, and including Ontario Institute for Cancer Research, where I'm the chair of the Patient and Family Advisory Council, and patient partner to OMPRN, which is tucked into OICR. I just leave this slide with a favorite quote of mine, believe it or not, taken from Mahatma Gandhi, and I don't quote Gandhi that often, but Gandhi said that the best way to find yourself is to lose yourself in the service of others. And this has been my compass. And I've been following that compass for many years and will continue to do so. So next slide, enough about me. And let's talk about getting involved and more involved, effectively involved in your cancer journey. Number one for slide, initiate self-education about your cancer early. Why is this important? I think one of the worst things started with at your diagnosis is fear of the unknown. And your cancer team has bombarded you with medical jargon and information that comes just, fast and furious. And it's really hard to process, and you're asking yourself, like, what the heck is happening to me? One of the first things you should try to do, and I know it's not easy at that state, is to start educating yourself and learning about your disease. And I think this really helps replace the speculation of the unknown with facts. You may not like all the facts that you learn, but it'll help you more clearly rationalize your situation. And I think it'll also enable a more productive, well-informed discussion with your healthcare team. And, to start with, ask your team for credible information about your cancer. Information can be provided via materials provided at the clinic. You can ask for links about your disease from cancer support organization, links to cancer support group discussion boards, links to publications, credible publications on the internet, and definitely try to seek sources in lay language so you understand and can self-educate. I think it's good to focus your research on your type of cancer and subtypes, how your cancer is staged, your prognosis based on type and staging, the use of biomarkers, how biopsies and imaging is used, learning about treatment options and how your cancer is managed through standard of care. And of course, related to treatment options, research, their effects, side effects, and impact to your quality of life. And I found that some real good resources have been that I've used quite frequently as Canadian Cancer Society resources online. Some wonderful stuff there. A real good one is the Cancer Care Ontario website. It's just loaded with information about cancer and treatment approaches, treatments that are approved for use in Ontario. It's a wonderful resource. Health Canada and the Canada's Drug Agency have some wonderful resources on their website as well. So next slide. So you really need to be prepared for your clinical appointments. And I know that sounds obvious, but it's so true. So have a list of questions prepared and make the most of the time you have with your cancer care team members. And they are busy. Clinics are super busy these days, crowded. Clinicians are constrained in terms of the amount of time that they can spend with you before moving on to another patient. So being prepared is really helpful to maximize your time and be as productive as possible in your meetings. So being prepared with questions can arm you to have like a more meaningful and in-depth discussion. So ask key questions, but also remember to bring support with you. And it's always good to have a scribe there because sometimes it's difficult to embark to have these conversations and write at the same time. If you're anything like me, you're going to forget everything once you walk out the door. So it's good to have somebody there that can support you that way, and also just support you as well from just an emotional standpoint, and having somebody to be there to lean on. And the other thing really to remember is to really establish a clear communication. Ask for lay terminology. Try to ask your clinician and healthcare team members to avoid jargon. And ensure expectations are set thoroughly to address your questions throughout the appointment. Okay, so what are some of the key questions to ask? And these are things that maybe you have self-educated on, which is really good. And it's always good to be prepared and armed with some background information when you ask these questions and get into a deeper discussion with your clinician. So, the type of cancer you have and what stage is your cancer and your prognosis, what treatments are recommended and why, and what is the goal of the treatment, and what outcomes can I expect, and how is the treatment delivered and where, and what are the treatment timelines? What are possible side effects of the treatment and how are they controlled? What type of lifestyle changes can I expect before and after the treatment? And what are the chances that my cancer may recur? And how is that managed? And what complementary and alternative treatments would potentially be beneficial? So this slide is about self-reflection and goal setting. And in your self-reflection on deciding what's best for you and goals regarding desired outcomes and treatment experience is really important. Now, I know this is not easy, and it may be somewhat of an ongoing process that may continue to evolve as you learn. But I think it's an extremely important thing to understand what you want out of your treatment and what sort of outcomes and experiences that you expect. And that takes a lot of inward reflection. Everybody's situation is different. Somebody who's new to cancer and is embarking on the induction side, early induction side of cancer, and maybe facing first-line treatments is one thing. If you're heavily pre-treated already, and you've gone through 4 or 5 lines of treatment, and your goals may be slightly different than the person who is just newly diagnosed. And also involve family members in the decision-making process as they're going to be impacted. So what are the benefits of active involvement? in your cancer diagnosis and cancer journey. Self-advocacy and being prepared is important, given how busy and challenged healthcare staff can be. Being involved reduces anxiety and fear of the unknown through your self-education and preparation. I think it gives patients more of a sense of control and confidence, and it helps build an open and collaborative relationship with your cancer team. It also helps to, achieve personalized care in a way that's important to you. And I think it also helps to establish an optimal approach to the management of your disease. So just a few other insights. If you do not connect with your cancer care clinician and team and are not confident in their diagnosis or treatment approach, you definitely have the right to ask for a second opinion. I think you really need to take good notes at each appointment, as it provides a record of events that can be referred to if needed. And try keeping a diary and writing down symptoms and treatment experience, discussions you've had. And yeah, this can be a useful record if you feel like your concerns are being dismissed. And keep your own record of test results and imaging, clinician appointment summaries, prescription scripts related to your diagnosis and treatment, and take advantage of programs that are offered by the cancer clinic. Really important. Consider mental health challenges that impact most of us, impacted myself and our families. And remember about exercising during treatment and post-treatment. Nutritional and dietary advice is important. The ability to actively communicate and interface with your cancer care team during treatment and post-treatment, I think, is really crucial to receiving optimal treatment. Make sure communication expectations are set with key members of your cancer care, and contact numbers and email, text addresses are noted so you can effectively communicate with them as close to as a real-time basis as possible. And finally, consider clinical trial participation. And clinical trials are a wonderful thing, and they provide a lot of opportunity to patients that maybe a majority of the cancer patient community doesn't know about. And it can provide you access to new treatments that may, excuse me, not yet be available in standard of care, and new novel types of really effective treatments. The clinical trials are very, very well designed. They're safe. They're very ethically run and closely monitored, and offer you expert oversight by a clinical research team that is very, very accessible. And it's great having that relationship and that collaboration that you can rely on, 24/7. Before you get into it, of course, explore benefits and risks, read your consent forms closely, discuss all potential benefits and risks with your clinician before deciding. And remember, you always have the right to withdraw or opt out of the treatment, opt out of the clinical trial at any time without affecting access to your standard of care. So that's it. And thank you very much for listening. I hope that was helpful. And what I will do is turn it back over to Vanessa.
All right, thank you so much, Terry, for that presentation. And now I've got Karen's slides up. So Karen, if you are ready to go, we can proceed with your part of the presentation.
Okay, yes, thanks to your help, I am ready to go now.
Awesome.
Technical things are, well, they're hard. So thank you, Terry, for jumping in and actually doing that first. Unprepared, unplanned. Terry is always a hard act to follow, but I'll do my best. I'll take a different approach. I like storytelling, so stay tuned. What if during the next 15 minutes or so, I'm able to shed a little light on the topic of molecular pathology in such a way that you would feel encouraged and able to learn more and talk with your family, friends, and medical team about how it relates to you. For the past 2 years, as Leanne mentioned previously, a small team has been working on writing micro-learning modules for patients and families about this topic, molecular pathology. So during the next 10 minutes or so, I'm going to introduce a few of those lessons that we've all worked on. My perspective is that of a caregiver. And next slide, please. I was introduced to childhood cancer in June 2002 when my then 2.5-year-old son was diagnosed with a malignant brain tumor. He had surgery and then chemo and radiation. And he had recurrences when he was 5.5 and 9.5. And then in June 2021, he was diagnosed with an ultra-rare sarcoma that had already metastasized when it was found. I'll fast forward to his story. Good, he's doing well right now. He's a registered nurse and on daily treatment, and always pursuing what's next in terms of treatment. So back in 2002, when my son was diagnosed, I knew nothing of childhood cancer. I understood a few things that the doctors were talking about because I happened to have taken a neuroscience course in university out of interest. However, my husband felt lost. He was an engineer, is an engineer, and German is his first language. The medical terminology was overwhelming. A nurse practitioner worked closely with our neurosurgeon, and she was able to sit down and explain many terms and to show my husband images that helped him to understand. She also gave him a book that was written by a neurosurgeon with an engineering background. When my husband understood things, he was able to ask questions and participate in discussions, and it helped him significantly. Through the first few months after our son's cancer diagnosis, we were introduced to many different healthcare professionals, including a speech pathologist, an occupational therapist, a physiotherapist, a dietitian, and a social worker. The most significant professionals for the first few weeks were our neurosurgeon and our neuro-oncologists and our nurse practitioner. We were then introduced to nurses who set up the chemotherapy and the pharmacist who taught us how to give our son chemotherapy at home. And then a month or so, 2 months later, when my son was ready to be in radiation, we met our radiation nurse and the radiation oncologist. So all of these healthcare professionals were our son's tumor team. So I want you to think about this. Who is on your team? And I wanted to highlight a couple of resources that we have on the OMPRN patient resources page. We have interviews with some professionals, and then we have an infographic on support professionals in healthcare. Some things to consider. I mentioned that my husband, he was able to see images and then read a book. And this brings to light the fact that we learn differently. So be aware of how you best learn and seek out the resources in that format. There's videos, there's books, there's written material. So find that resource that is going to be most impactful for you. Be aware of what you want to know. My husband and I disagreed strongly on the survival statistics. I did not want to know them. He did. So I politely asked the doctors to never mention them when I was around. So be vocal about what you're prepared to hear, and be confident. You can control. You're sort of the gatekeeper for the information that you're ready to absorb. I was keenly aware. What did I need to know? What was I okay with not knowing? What had to happen in order for me to feel comfortable about those decisions? So I would encourage you, if you haven't already, think about those things. Okay, next slide, please. I wanted to share about one thing that I learned early, and that was to find out what will happen or what to expect at each appointment. This was early on in my son's treatment. We had returned to the hospital for a clinic visit. It was his first outpatient clinic visit, and the nurse had to do a finger poke to get a blood sample. My son cried. And so that visit, I asked his team, especially the contact nurses, what are we to expect every visit? Or will there be variations in the visits? Equipped with that knowledge, I was then able to help my son prepare in his little, very young 2.5-year-old mind. As mom, I knew him. I knew how to prepare him. And so after that first sad visit where he cried about the finger poke, I asked him, so tomorrow at clinic, what finger do you want Nurse Connie to poke? And he was nonverbal at the time, and he held up his index finger. And then on the drive to the hospital the next morning, I said, oh, I forgot. What finger do you want Nurse Connie to poke? And he held up his index finger. And then when we were actually in Nurse Connie's room, I said, oh, show Nurse Connie what finger she can poke. And he was proud. He gave her his finger to poke, no tears. So figure out those strategies that work for you, or if you're a caregiver, work for your child. And on that note, think about this. Are there things that you did or wish you had done? Or maybe think about it this way. What advice do you give to friends or family when they ask you how to navigate a cancer diagnosis? Those are your stories. Those are ways that you can transfer your knowledge to others. I asked Terry if he would contribute a story here. Terry, are you prepared to?
Yeah, I love your I love your story about the finger. And it's so important that you thought out of the box and used an innovative way to enable the treatment to continue without overly traumatizing your son. I think it's so important. You don't want people to avoid treatment on the basis of inflicted pain, and which is sometimes unfortunately part of the treatment. My similar example that I can draw on is the bone marrow biopsies, that bone marrow aspiration treatments that I went through as part of my treatment monitoring. And they were super painful. And the first one I had to have two nurses hold me down because I was in that much pain. And for a moment I was thinking, why do I want to go through this? I mean, it was really a necessity for the treatments, but I was just thinking, there's got to be a better way. And if I may digress, there is a better way that is on the way, that will replace bone marrow biopsies through something called liquid biopsies. And they're gaining momentum in terms of being available in the clinic, and could be utilized through the a regular blood sample versus having somebody get their bone marrow extracted through a painful process. So I don't know. I mean, where am I going with this? I mean, it's really there are better ways. Sometimes you can motivate yourself to bull your way through it. For me, this is one of the reasons I got involved in cancer advocacy and cancer research, was to really, promote the use of these new types of procedures that are less painful and are not going to scare people away from potential treatment. So
Thanks, Terry.
a little bit of a ramble there, but
but you brought up a really good resource, another lesson in our library on the website. So yeah, back to the slide here. What I learned over time, and I'm sure everyone has stories, depending on how long they've sort of been in this cancer journey, regardless of the role that you're in. What I learned over time was determine the type of information that's important to you and focus on that first. For example, I wanted to understand blood values and how I could help my son by feeding him certain foods. Early on, I had read the phrase, calories are king, and that stuck with me. So while my son was going through chemo and radiation, we just focused on getting calories into him. So if he wanted croissants with chocolate spread, that's what he ate. And my add-on phrase was, nutrition can come later. There might be dietitians who recoil in horror at me saying that, but it worked. I found it helpful, and I know Terry mentioned this earlier, have a notebook. I wrote down everything that the doctor said, and I wrote my questions there to prepare for future appointments. In another book, I had a folder. It was more like a folder. I kept all the blood test results and other papers so that I could track the blood. I journaled, and I often referred back to what I had written in the journal and also in the medical notes notebook. Next slide, please. Research is care. I believe you'll start to hear a lot more of this if you haven't already. What brings this up is when our primary neuro-oncologist said that the next thing for our son was chemotherapy, he also informed us that our son would be part of a clinical trial. I didn't understand what that meant. And so I asked, are you experimenting on my son? His answer, his explanation, of course, was no, clinical trials are not an experiment. Clinical trials, to get to a clinical trial where humans are involved, there's a rigorous process, there's ethics, there's countless people looking through protocols. But going back to that day when I said, "Are you experimenting on my son?" That was truly the beginning of my journey into becoming a patient partner. I wanted to understand things, so I asked questions and I read. Over the years, there were deeper layers to my connection with my son's doctors. I was invited to be part of clinical trial teams and provide the perspective of patients and families as an advisor in different projects and patient advisory groups. I looked for opportunities to deepen my knowledge and contribute to making research better. This included being on the Ontario Cancer Research Ethics Board for 6 years as a pediatric community member. Now, at the bottom of the slide here, you can link to this lesson. It's about clinical trials. It's an excellent whiteboard animation. So I encourage, if you have curiosity, go to the OMPRN website and view that. Next slide, please. So as you likely know, there's so much information out there. It's important to source credible information from the oncologists and other specialists. It's important to ask your medical team where else to go for information, whether it's certain sites on the internet, books, pamphlets. I want to encourage you, learn from reputable sources about how cancer research works, about research ethics, about research trials, and about standard treatments at other hospitals or in other countries. And like Terry said, if possible, have a family member or friend join you at appointments. It's important to have somebody else who's hearing the information and maybe jotting down what they hear. It's traumatic to hear about a cancer diagnosis, and trauma can reduce a person's ability to remember information. And then one more thing on this, ensure at the beginning of your appointment to set expectations that time will be taken to answer and discuss your questions to the fullest extent. And I think I'll end there just in the interest of time. There are a couple more slides which you can always visit if you rewatch this video.